Welcome to another edition of Our City. A few things going around the city of Elizabeth this week. On Tuesday, December 13th at 6 o'clock, I'm going to join Councilman Frank Mazza and the residents of the 6th Ward for their annual tree lighting ceremony. This event will take place at the Peterstown Community Center, will feature holiday music and, of course, a visit from Santa. And on Thursday, December 15th at 6 o'clock in the evening, I'm going to join Councilman Carlos Torres of the 1st Ward and the residents of that community for the 1st Ward tree lighting ceremony. And this event will be held at the Todd Bowles Waterfront Soccer Field on Front Street in the city of Elizabeth. And naturally, holiday music, some giveaways, and of course, a visit by Santa. Immediately following that event, a Winter Wonderland extravaganza. This will take place at the Miller Evans Logan Recreation Center. Toys will be given out, and of course, a visit from Santa. On Friday, December 16th, Missionaries on a Mission will have a gift giveaway. This event is held at the Stephen Sampson Center, located at 800 Anna Street in our city. And on Sunday, December 18th, around 3 o'clock in the afternoon, I'm going to stop by the Merlin Soccer Club Holiday Awards Ceremony. This is held at the NV Nightclub, located at 323 North Broad Street, the old Winfield Scott Hotel. If you need more information concerning these events or any other events in the city of Elizabeth, please call our Public Information Office at 908-820-4124. And if you can stay with us after these messages, I'm going to be joined by Mr. Mark Colicchio, the health officer in the city of Elizabeth, talking about issues that affect our community.
Why do we like it here? Let's just say the reasons are diverse. Kean University.
Welcome back to our city, where I'm pleased to be joined by Mr. Mark Colicchio, the health officer in the city of Elizabeth. Mark, welcome to the show.
Thank you. Nice to be back. How are you?
You've been on the show before.
Yes, I have.
Tell us about a little bit about your history. You started with us, you left, you went back, but you got good experience along the way.
Yes, I did. I started working in the city of Elizabeth in 1989 as an air pollution inspector. My supervisor at the time encouraged me to go back to school. In order to advance in the career, he said your best way would be to be licensed as a sanitary inspector, which we now call environmental health specialists. So I went back, I took the science courses I need to get into the class at Rutgers. We took a summer course entitled Environment and Public Health. It was the equivalent of shoving 18 hours into a 7-week class, where they taught us everything to know about public health and environmental health. Then we had to do a 5-week internship in a municipality and sit for the state exam. So I then advanced to that in 1992. In 1993, 94 or whatever, I left to pursue a career with the city of Englewood as a registered environmental health specialist, where we actually did more research. We published articles for our food establishments and for the community. And from there, I got an opportunity to go to the city of Newark as a chief sanitary inspector in their childhood lead poisoning prevention program. It's actually where I learned all about childhood lead poisoning, working with both the nursing aspect and the health aspect, and working with other municipalities. During that period of time, I was pursuing my master's degree in order to get my health officer license. So I was hired part-time to work for the city of Elizabeth to do retail food inspections while working in the city of Newark. And then eventually in 1995, I came back to the city of Elizabeth as a senior sanitary inspector, where I would be doing food establishments, and then eventually getting promoted to assistant health officer. And in 2003, the opportunity came to be the health officer of Morristown. So I pursued that, and from Morristown, I went to the State Department of Health and Senior Services at the time, where I was a program manager for the Sanitation and Safety Program, which oversaw recreational bathing, body art, regulated medical waste, and a whole pursuit of other activities, tanning salons, youth camps. And then from there, I went to the city of Plainfield, where I became the health officer there. And in 2012, came back to the city of Elizabeth as the assistant health officer. Eventually, in December of 2014, I was made health officer for the city of Elizabeth.
So you have 27 years in government.
Yes.
Oh, wow.
Yes.
You don't look that old, Mark.
Thank you very much. Thank you for the compliment. I turned 50 in January.
So as a health officer, wow, as a health officer for the city of Elizabeth, you're responsible for overseeing an awful lot. Tell us about some of those areas.
Yes, part of what I oversee the Public Health Nursing Division, which we've had them on the show before. They do all of our clinics, our STD clinic, our flu immunization clinics, our child and health clinics. They investigate communicable diseases along with a whole array of community activities. They're very visible in the community, our nurses. I oversee the Environmental Health Division, which we'll be talking about the second part of the show. That's where all of the housing, the retail food inspections, they come into it. Our Division of Animal Control, we've had them on the show before, where we oversee the animal shelter and all the activities that goes on in the animal shelter. Let's see, our dental clinics, our 2 dental clinics, which we've had on the show before, at School 1 and School 3, and of course our Office of Vital Statistics, where people can come in and get their birth, their death, and their marriage certificates.
And so the Division of Health, all of those components are within the Division of Health.
Yes.
And so what are the requirements? You talked about education and a master's degree and some other thing. Do you need all that to be a health officer? What are the requirements to be in the state of New Jersey?
In New Jersey, to be licensed as a health officer, you have to have at least a master's degree in something dealing with the health field. My master's degree was in health administration with a concentration of public health at New Jersey City University. Now, with that, you need certain coursework. You need certain coursework in epidemiology, which is the study of disease, biostatistics. You would need a course in planning, administration, and environmental health. Once you get that, then you have to prove to the state that you have at least 2 years of administrative experience in certain categories, like administrative services, and chronic disease, communicable disease, maternal and childhood health, and environmental health.
So all of that is encompassing in order to get a health.
And that's just to sit for the exam, and then you would have to pass a state exam.
So the organizations and agencies that you work with to improve the health, not only the ones you just mentioned, but you have to work with other agencies and organizations as well. Tell us about some of that effort.
Yes, some of the agencies I work with are the New Jersey Association of County and City Health Officers. It used to be called the New Jersey Health Officers Association, which we are a member of. The Union County Health Officers Association, which we're a member of. The Union County Governmental Public Health Partnership. That also encompasses the health officers, the hospitals, and different organizations where we get together and we formulate something called the Community Health Improvement Plan for the city. That's an entirely different show. That's an entire different show topic to talk about. I work with the Union County Office on Health Management. And in conjunction, we work with other agencies, the New Jersey Environmental Health Association, Trinitas Regional Medical Center, and a whole other Hoboken Family Services, where we have our New Jersey SEED program, our cancer education and detection program. We have that. The Rutgers School of Public Health, we work with them on a array of issues, and we also work in conjunction with Rutgers University's Lattimore Tuberculosis Clinic. They provide us with services for tuberculosis, dealing with the diagnosis and treatment and investigation of people having tuberculosis within the city, and a whole array of other
So
agencies.
tell us about the environmental health program, Mark, it's within the Division of Health, and
Yes.
you talked about that in the beginning of the show a little bit, but tell us more about the environmental health program.
Well, the environment, our surroundings, it affects everybody. The environment is constantly changing, and it's basically up to us to adapt to it. So we have an environment, in all health departments throughout the state, they have environmental health programs, certain things that are mandated to be done. inspections of our retail food establishments. We have roughly 1,000 retail food establishments which are inspected on a yearly basis. We have
to inspect all 1,000 on a yearly
Yes.
basis.
Yes, and we've been successful in getting that done. So we have, with that, along with retail foods, we have roughly 8 recreational bathing facilities. They have to be inspected at least yearly. We have 8 youth camps which have to be inspected yearly. We do all the schools, all the daycare centers, and we also have housing inspections which are done by public health investigators. And we have roughly over 1,000 complaints that come in dealing with high weeds, dealing with issues like bed bugs and other quality of life issues that come up. And we do a whole array of other services. I mean, pretty much whatever. When people are not sure where to come for something, they come to the health department. And, we do our best to direct them in the right area, or if not, we help them in any way that we can. We don't turn anybody away.
So how the environmental health program, how is it staffed?
It's staffed, it's overseen by the health officer, myself. And we have a senior registered environmental health specialist, and we have registered environmental health specialists. Those are the equivalent of what we used to call sanitary inspectors. And there's certain education that's required for that, which such as you have to have a bachelor's degree with at least 32 credits in the math and sciences. You have to go through that 7-week class at Rutgers, that environment and public health, do a 5-week internship in a municipality, and pass a state certified exam. So we have them. We have lead inspectors. They do our childhood lead program. They work in conjunction with the public health nurses to not only try to prevent lead hazards, but children that are poisoned, we go into the houses and dwellings, we make inspections, and landlords have to fix and abate whatever it is they have to abate so that the child is in a lead-safe house.
Lead abatement is a challenge because if kids are subject to lead for too long of a period of time, they can get violently sick.
Yes, they can. They can suffer neurological issues. I'm proud to say, though, that our lead cases in Elizabeth, they've been coming down. The rates have been coming down. I have experience with lead working in the city of Newark in the 90s, where we would have 1,200 cases come in a year with 6 lead inspectors to handle them. So when I was with the city of Newark, we had a very, very big caseload. But you know what? Everybody worked together, and everybody does everything that they can do. But in the end, it's to help the child.
Mark, we're going to take a break and come back and talk about the food establishments in a few minutes, all right?
Yes.
Please stay with us and we're back with more with Mark Colicchio.
In this tough economy, you need to make smart decisions. Shopping in Elizabeth is one of them.
In Elizabeth, you'll pay just half the state sales tax.
Only 3.5%.
When you visit our thriving downtown shopping districts.
The savings are just as great at the IKEA store.
And the Jersey Gardens Mall, the largest outlet mall in the region.
Elizabeth has great restaurants.
A one-of-a-kind Lowe's movie theater.
Brand new hotel.
There's something for everyone.
So be smart. Shop Elizabeth.
We're an American original. Dependable, historic, nuanced. With all the comforts of home, even when you're just visiting. So we're celebrating for all that we've left untouched and all that we've changed. A place where the past meets the future. So consider this your invitation.
We've been celebrating here in Elizabeth for 350 years, and we're just getting started. Welcome back to our city, where I'm joined by the health officer in the city of Elizabeth, Mr. Mark Colicchio. Mark, tell us about the retail food inspection program. You were talking about it before the break. 1,000 restaurants, and we got to get to them on a yearly basis.
Yes.
What do we do when we get to them? What's expected of the retail food establishment?
All right. Well, we have many different types of retail food establishments. When most people think of retail food establishments, they think restaurants. They think all we do are restaurants, but restaurants are only part of it too. Retail food establishments encompasses restaurants, and whether it's sit-in restaurants or takeout restaurants. Supermarkets, they entail supermarkets, they entail grocery stores, convenience stores, hotels, motels, vending machines, our festivals, our same-day festivals that we have, our mobile food units. And I mean, there's a whole array of them. Dance nightclubs. I mean, anything that serves food. Food under the code is anything that is used for human consumption. So anything involved in that, pharmacies and drugstores, we have to do inspections on these establishments.
Really?
Yes.
So what is the Environmental Retail Food Program?
Well, pretty much it's the inspection system that we set up on a yearly basis that covers the inspections of all 1,000 retail food establishments that come into the city. And pretty much what we do is we go in and we check to make sure that they're up to date on their retail food license. And then we want to make sure that they have the qualifications that they need. For example, certain restaurants, like what we call our Risk 3 type restaurants that have they have heavy menus, like your full-scale restaurants, your diners. They're required to have a person in charge that's a certified food manager, and such as they have to be ServSafe certified. So we want to make sure that they're certified. We want to make sure that the food is being handled properly, that the place is kept clean, but more important, sanitary. Are the food temperatures right? How are they storing the food? We just want to make sure that raw foods and what we call ready-to-eat foods are not mixed in together. So our job is to prevent the spread of disease, to prevent foodborne illness.
And I guess do you run into some difficulties without mentioning any places?
No.
No, never?
No, of course we run into difficulties. But what our goal is to educate retail food establishments. We're actually their consultants. A lot of people have come up to me and say, boy, food establishments must be afraid when you guys come in. No, we don't want them afraid. We want them to know that we're their partners. We're there to educate them. We do enforcement only as a last resort if we have to. A lot of people think that we go around and we close food establishments. It's the very, very last thing that we ever want to do is have to close a food establishment for unhealthy practice. Our goal is to educate them and to get them better.
But say a refrigerator or a freezer breaks down, or there's a flood in the basement, there's food, you have to make sure that's all tossed, right?
Yes. Yes, we do. We have to make sure that that's tossed, and certain situations like that, we may have to close the retail food establishment. And yes, we have to make sure that any food that is not healthy to serve or prepare, yes, it has to be discarded.
So do you eat in the restaurants in Elizabeth?
Yes, I do. I eat in my restaurants, and so does my wife. My wife really loves the restaurants in this city.
So, Mark, switching gears a little bit, you've been invited to speak on the Zika virus in Washington, D.C. come March.
Yes.
First of all, tell our viewers, what is the Zika virus?
Sure. The Zika virus is transmitted by mosquitoes. It's been very heavily publicized this year because the effects from the Zika virus in women that are pregnant can cause birth defects in babies. So, which is why it's very important. It's been around for many years, the Zika virus, but has been more prevalent this year in certain mosquitoes for some reason.
So we don't have to worry about that in the winter, though.
In the winter, no. Once everything freezes, once we get our first frost, then what we would say in our area, mosquito season would be over. But you're always worrying because people constantly traveling to those areas where Zika virus is more prone. So we always have to worry.
So is it transmitted from person to person?
Person to person, yes, through sexual contact.
Okay. And the Zika virus is initially put through from a mosquito bite, though.
Yes.
And so, who invited you to speak in Washington? By the way, this is a pretty nice thing to do.
It's some sort of company. They put together conferences on different topics and trainings, and somehow they got my name as being the health officer of the city of Elizabeth, and I was invited to speak. And
other things that have happened in the city of Elizabeth regarding some other issues, you've always been on top of them.
Thank you.
How do you plan for that, Mark? Because it kind of hits us over the head once in a while.
Well, you know what it is? We do the best we can, and working with these other agencies for planning, such as Union County. Union County is a very, very close partner of ours, especially the County Office on Health Management. And you know, they help us with emergency preparedness, and they help us prepare for outbreaks, working with the State Department of Health, too. I mean, I'm very lucky in my years of experience and working for the state where I have connections. I mean, it's knowing who to call, when to call them, and not thinking you can do everything yourself. And the most important part of my success as a health officer is my staff. I work with I would say the best health department in the state of New Jersey. I'm very proud to work with these people. They're very dedicated public health professionals. I work for an excellent director and an excellent mayor. So it's all about teamwork. We all work together.
So, Mark, you talked about preparedness. One of the things, Trinitas, if anything ever happened here, they have a decontamination unit, right?
Yes.
And if we had to deal with that, would you oversee that?
Well, I would be working in conjunction with Trinitas Regional Medical Center, Phil Solomon, their emergency planner. We work very well together, and we also work very well with the infectious disease department of Trinitas Hospital. So we're always in constant, close communication.
One infectious disease comes to mind you always hear about. People get scared is meningitis.
Yes.
Are we notified if there's a case of meningitis at a hospital?
Yes, we're notified immediately. I mean, meningitis is an immediately reportable disease. So the hospital or lab they're required under law to report it to the local health department.
And do you have to then do checks on who this person was in contact with?
Yes, and there we would work in conjunction with the New Jersey Department of Health and their epidemiologist that's assigned to our area. We work very closely with them. I mean, where we go out and we do whatever investigations needs to be done, we trace contacts, we make sure the contacts are tested and treated. And between working with our public health nurses, our regional epidemiologist, and the hospitals, it's all covered.
And it's the same thing with HIV and STDs. If there's a positive test, someone has to notify the partners?
Yes, and
that's done confidentially?
Yes. We have an STD clinic in the city of Elizabeth where we have service agreements with most of the municipalities throughout Union County where they come to our clinic and we report our results obviously to the municipalities we have contracts with, and we have an investigator. He goes out and he investigates contacts with the goal of bringing them in to get tested and treated if need be to prevent the illness from spreading. And syphilis has been heavily on the rise lately, specifically in populations between 15 and 24 years old.
So the aggressiveness of a health department can help stop that from progressing.
Yes. Yep. Yes, we do. And again, we provide a lot of services, a lot of education out there. We have people that go out, whether they're in their specialty or not. If something happens, everybody chips in and helps. And that's what I love most about working in the city of Elizabeth. And I'm very proud to be the health officer in the city I was born and raised in.
So Mark, tell us a little bit about young people. Do you have to deal with anybody in the schools? Or do you give any seminars in the schools, or does anybody else in the department talk to the kids in the schools about health-related issues?
Well, we have an office on, a lot of that is referred to our Office on Youth. I mean, and anything that they would need from us in regards to going into the schools, we would certainly help them. And we have our health educator, Andrea Topping, where she organizes a lot of stuff too, but most of that is done through the Office on Youth.
So Mark, rewarding career, huh? 27 years?
Yes.
Very interesting.
Thank you.
How do people contact you if they need to get a hold of you?
People can call me in my office. My number is area code 908-820-4089.
And if they have any health-related issues, they can call you there.
They can call me, and we'll help them the best we can.
So you mentioned earlier in the show, Mark, about the health officer has to deal with high weeds or overgrowth in yards, and usually they're from neighborhood complaints, correct?
Yes.
And what happens when you go out there? There's a process. You give them notice. Talk to us about that process a little bit.
Sure. It high weeds along with any complaints, such as garbage or anything dealing with housing. We go out and we conduct an investigation. And if we find the violations to be valid, then a letter needs to go out to the person responsible for abating the violation, where they have X number of days. A follow-up is done, and if the violation is corrected, that's what we look for. If it's not corrected, then the inspector has the option of reaching out to the landlord to see what's going on. Maybe the landlord needs more time. All right, so we are more than happy to give an extension if it's warranted. If not, then a court summons is issued, and then it's all settled through the courts.
And sometimes, in most cases, the people or the homeowner or somebody will come and cut the grass.
Yes, for the most part. But over the past couple of years, we developed a new initiative where instead of actually sending a letter, we have these green placards, these green door knockers, as we call them. And we post them to the door with a note, and that's their abatement notice to give them the 10 days to cut the weeds. And this way, it keeps from mailing out a whole bunch of letters. It gets to the landlord quicker, and the problem is resolved more quickly.
It is. So it works better.
Yes.
Oh, that's good. So anything else you want to add, Mark, regarding a health officer's position? You covered an awful lot.
Yes, we did. We covered a lot in a short amount of time. But the thing is, though, public health is always changing. Our goal is to prevent the spread of disease. And you know what? I thank you and the city of Elizabeth every day for giving me the opportunity to serve this fine city. And I was
Well, we thank you. We thank you for your efforts, and we thank you for your efforts in keeping the city safe through health means. Thank you very much.
Anytime.
For Mark Colicchio, the health officer in the city of Elizabeth, I'm Chris Bolwage, and we'll see you next week on another edition of Our City.
Sometimes you learn by helping others learn. Kane University.